my name's Stacey. I'm a registered public health practitioner with the UK Public Health Register and the Faculty of Public Health. I'm a fellow of the Royal Society of Public Health, and I work as a programme manager in the public health team at Lincolnshire County Council. My broad remit is around primarily workforce development, but also public mental health as well. So I suppose I'd categorise it into two. The first is the sort of population level anonymised data that we get access to support our work in public health around undertaking health needs assessments. As a local authority, we have a responsibility to undertake a joint strategic needs assessment as well for Lincolnshire. So that's a county-wide assessment of health need, not just in terms of clinical need, but also in terms of wider determinants of health, so housing, employment, socio-economic need. And we have to undertake that under legislation. So we have a sort of legal responsibility to do that. So there's that population level data. But equally in the public health team, we commission services, public health services as well, sexual health services, substance misuse, wider healthy lifestyle services. So we get access to a range of data from those services as well in terms of the types of demographics around people that are accessing our services, the types of needs they have, but ultimately the types of outcomes that we're able to achieve for them in terms of things like quit smoking or physical activity in terms of minutes of activity a week, etc. So a range of data really. When it comes to service level data, part of that is about holding providers to account for the money that we give them to deliver services, clearly. So we commission them to achieve outcomes for our population, and we want to make sure they're delivering those outcomes. So part of it is about accountability. Part of it is about our wider responsibilities in public health in terms of improving the health and protecting the health of the population. So we use that data to, like I say, to inform our needs assessments. So we will typically undertake the joint strategic needs assessment, but similarly we'll do deep dives in terms of health needs assessments into specific areas of health need where we see there's a particular need to do that. So in the past I've been directly involved in, for example, the recommissioning of substance misuse services, so alcohol and drug treatment services, and as part of that we've undertaken a full health needs assessment into substance misuse in Lincolnshire, from the point of view of clinical need, expressed need in terms of people coming forward for services, and felt need as well in terms of the sort of qualitative information about how people accessing their services feel about the service that they receive from our commission providers. I think more than ever the importance of population level data to inform health policy in its broadest sense has become really prevalent. So an example of that, I suppose, would be the fact that from a public health point of view, we're really interested in health inequalities, and a lot of the data that is now available really does drill down into where those health inequalities exist in populations, and some of the examples of how that's led into policy decisions are at a national level, for example, from the point of view of NHS England's core 20+5 programme, which is all about how the NHS specifically narrows the inequalities gap in the way it delivers service and delivers equitable services. And in Lincolnshire, we take that approach as well from a public health point of view in terms of how we influence NHS partners through our public health advice to make sure that equity is at the heart of everything they do in terms of NHS provision. I talked earlier about the joint strategic needs assessment. In the local authority, we have a statutory requirement to consider the evidence in the joint strategic needs assessment as part of every decision we make as a local authority, which directly impacts on the lives of our communities. And so all of our reports that go to all of our committees of councillors for a decision have a section on them where we have to evidence that we've taken account of the health need within the joint strategic needs assessment as part of recommending the services that we might deliver to our communities, which obviously then has a knock-on direct impact on our communities. Some of the other examples, I suppose, from the community angle are that we do quite a bit of work to try and publicise and encourage communities to think about what the needs are in their communities when they're applying for things like grant funding. So we've recently undertaken a procurement for low-level grant funding for people to support suicide prevention work in the county, and as part of that application process we've asked local community groups to really think about what are the needs in their communities and what is the available published data that's out there telling them about what they think they need to deliver in their communities to address that agenda.